The Zika virus is causing global concerns as it spreads. Just today, Colombia's president announced more than 3,100 pregnant women in that South American country are infected. Over the past week, the governors of Puerto Rico and Florida have declared public health emergencies because of the mosquito-borne illness. So what should you know about it? The medical A-team, Dr. Manny Alvarez, is here to help us sort fact from fiction. Dr. Manny, we see these headlines. We just saw that one out of Colombia. How worried are you about this virus?
Well, I'm worried because every day we learn something new. So let's recap what we know so far. We know that this is a virus that spread through South America, Central America. Now we're seeing it here in the U.S. This is a virus that is transmitted mostly by mosquitoes. So it's very important to know that fact. We also know today that you can get it in saliva, we see it in urine, and we have seen it in breast milk. And we have cases now where we have seen it that it can be transmitted sexually. So this is now a different story because of the way that you can get the infection. We also know that you may have Zika but not realize it. The symptoms are very mild, very broad. You can get, low aches and pains, fever, a little inflamed red eye maybe, but nothing major that would take you to the hospital. We also know that if a pregnant woman catches the virus, especially in the first or second trimester, this could lead to a congenital condition of microcephaly, which is small brain and small cranium, which is debilitating and very bad for the baby. So we know all those things. And we also know now that perhaps blood transfusions could be a big problem in the future because, a blood donor can be infected, donate blood, and if you get that transfusion, theoretically, you can also get the disease. So we have several ways of spreading Zika. Mosquitoes are still the main issue, of course, and statistically speaking, we're seeing more countries being more transparent in giving us the numbers of affected individuals. So this is something that the world has to come together, and we have to create plans of entry, how to prevent the spread of the disease, and more importantly, how to eradicate these mosquitoes.
And we see the videos, and it's hard to see the videos of the small children with their tiny heads, essentially. But the virus doesn't just pose a threat to pregnant women. It can also pose a threat to the general population.
Yeah, we see more and more cases of a condition called Guillain-Barré. This is a syndrome that basically it's an inflammation of the central nervous system, and an adult, whether male or female, you can end up with muscle weakness, unable to walk. A lot of people could end up in a respirator, and in many cases never really recover from it. So it does affect, it gives you an inflammation of the central nervous system, and you can end up with Guillain-Barré. We have seen pockets of that in different countries, including Colombia and Venezuela now.
And Dr. Manny, why are we just hearing about this now? The Centers for Disease Control has been aware of the virus for longer than we have, so why are we just learning about it?
Well, look, if you talk to scientists that deal with public health and people that are dealing with viruses around the world, they'll tell you, listen, we've been sounding alarms, for a long time. There have been many cases, outbreaks in many parts of the world over the last decade or so on Zika. But again, this is something that gets buried in scientific publications, and the public health officials sometimes are not worried about that. And what we have to realize, we live in a world where we have hundreds of thousands of people traveling around the planet all the time. We have migration now, population that is going from southern borders, coming to different areas of the world. We have a big problem with deforestation in many Latin American countries where they have destroyed their forests, and there's been no really control of mosquitoes in many healthcare programs in many countries. So if you take a country like Brazil that, went, belly up, decades ago, they don't put resources into public health, and this is exactly what happened. They have populations explosions, nobody pays attention, and bingo, you have these big outbreaks. And right now, they got caught with their pants down, basically, and we have to play catch-up.
Okay, well, my final question, what advice do you have for not just pregnant women, but for the general population ahead of some very warm months?
Listen, if you're pregnant, don't travel to any of these countries, and certainly don't travel where there's been reports of any Zika outbreaks. That's for sure. Number two, every hospital, including my own, we have put protocols in place to now ask questions about traveling, whether you went to, if you came from those parts of the world, because we have to be proactive. The CDC has put protocols out. If you're pregnant and you think that you were exposed to Zika, you need to be tested. You need to get ultrasounds and multiple times during your pregnancy to make sure that you don't have any surprises at the time of delivery with a microcephalic baby. So now we're sort of creating protocols, and you'll see more and more of this, where there's national awareness, and hospitals are going to be asking questions here in the U.S. in particularly about your traveling to areas of the country, because we want to know, and we need to do something about stopping the spread. So you're going to hear a lot about these things, including some exclusion on patients being able to donate blood, probably in many places of the country. So there's going to be more of these public announcements in the next 2 or 3 weeks.
All right, Dr. Manny Alvarez, thank you so much for joining us. We appreciate it.